Cellulitis in the foot. Cellulitis occurs when one or more types of bacteria enter through a crack or break in the skin and an infection ensues. The condition manifests itself as a redness and swelling, which is the cardinal signs of an infection. Causes of cellulitis. In the foot, sources of breaks in the skin and resulting infections include heel fissure, ulcers, burns, insect bites, trauma, cuts, scratches. Surgical incision. Possibly the most common risk in all surgery is the chance of infection. Athlete's foot. A secondary bacterial infection is very common with athlete's foot, which is one of the reasons that even if you have a mild case of athlete's foot, it should be treated. Dry flaky skin, swollen skin, thrombophlebitis. In this case, cellulitis can develop with no actual break in the skin. Cellulitis is caused by bacteria, generally Streptococcus or Staphylococcus, but there can be other bacteria mixed in. This is especially true in diabetics. People whose immune systems are weakened for any reason, including from chemotherapy for cancer or other immune-suppressing drugs, and those with diabetes or AIDS are at highest risk for developing infections. Symptoms of cellulitis. The problem usually presents itself locally as swelling, redness, and tenderness at the site of infection. Additionally, systemically, a person may also have fever, chills, elevated oral temperature, and swollen lymph nodes, which is usually seen in advancing cases. To further complicate matters, other problems will cause similar symptoms in the foot. These include superficial phlebitis, fracture, tendinitis, gout, local trauma to the foot. Treatment of cellulitis. Simple infections treatment is predicated on the severity of the condition. In a case of a healthy individual who has developed cellulitis secondary to an infected ingrown nail and it only extends an inch or so from the infection site, removal of the offending portion of nail and topical antibiotic medication is all that is usually necessary. Small localized infections may be treated with simple cleansing with soap and water, along with a dressing which includes a topical antibiotic ointment. Severe infections. In the patient who may be diabetic, may be on immunosuppressive drugs, a wound has to be evaluated for infection. General guidelines as to whether or not a wound requires oral antibiotics include the degree to which there is cellulitis, redness that extends way beyond the borders of the wound, an increase in pain in the area, poor quality of granulation tissue in the wound, increased drainage from the wound, tunneling, channels leading deeper into the tissue, and odor. If the patient has an elevated oral temperature, that too has to be considered. Antibiotics. If the criteria is met, an oral antibiotic is prescribed. Your doctor will normally start you on an oral antibiotic that is known as a broad-spectrum antibiotic, an antibiotic that kills a wide variety of bacteria. At the same time, your doctor will take a sample of drainage in the wound and send it out to a laboratory to find the specific organisms causing your infection. Most skin infections are either Staph aureus, most common, or strep infections. The key here is to take all of the antibiotics no matter how good the foot may look after a day or so. Typically, what happens is that the infection begins to look and feel much better in a couple of days and the patient will stop taking the antibiotics only to experience what is known as a rebound phenomenon where the redness and infection return, thus delaying the time it takes to ultimately clear up the problem. Locally, the affected area will also be treated with topical medication and a dressing to prevent reinfection. If there is an underlying cause such as athlete's foot, fissuring, dryness in the skin or foot ulcers, they all have to be addressed, otherwise the risk of reinfection remains high. Unfortunately, simple infections that are improperly treated many times will turn into severe infections. Depending on the overall health status of the patient, bed rest, intravenous antibiotics, and possibly hospitalization may all be necessary. Cellulitis is not a condition that can be self-treated. It requires proper medical care. Read the complete article at www.foot-pain-explained.com/cellulitis.html.